On that note, the second yellow of our 8 metrics that we track is in the quality space. So we have 2 measures that similarly report here. So this is that the CCO ends the year in a positive financial position again by achieving at least 100%. And while we are relatively confident we are headed that direction, all metrics are not currently in a green or safe place. So of the 14 metrics we work towards that are established by the state, there are a few that need attention. And it's important to note, I think, here in the notes below that, providers are experiencing turnover. Medical assistants remain in extreme high demand, along with just noting the incredible workforce shortages that are putting stress on our system. Often this work is done in positions that can have conflicting priorities in spaces like that. So just to be mindful. And again, we are yellow to green in this space. I'm going to go to the last 2 operations, and then I'd be happy to take any questions anyone's been holding on to. This operations 1 is to monitor external quality reviews and address any health services advisory group or OHA inquiries that come up. And really what I just want to say to you in this space is it's the same report as we had last month, which is all our audits are on track. So very positive response in under operations number 1. And operations 2 metric is to meet a resolution time of 30 days or less with 100% of appeals and grievances. So important to note that this data represents a look back at the second quarter, whereas most of all the other data was third quarter. So this is second quarter look back because of a lag. And again, we are meeting, there are no 100% of appeals were responded to in a timely manner in this space. So overall, meeting 100% again in this space. I know that there have previously been questions really about what does this mean? And even though we responded in this space, have grievances, what some of those outcomes were. And as we go throughout the year, we are gathering that data, and we could, if the board would or perhaps if this was better operational discussion, take some of that deeper information in a specific grievance and appeal conversation forward if you would like. And on that note, I'm going to ask if there's any questions.
We do have a couple of questions in the chat, but first let's get to, do we want to bring back for a deeper dive with grievances and appeals? Is that something that the group would like us to tee up? If so, be helpful to have maybe some thumbs up or head nods would be great. I see thumb up. Okay, very good. So that's looks like a yes. That'd be great. And it is always wonderful to have Peter McGarry with us. If there's an opportunity to pull him in, I just, not only does he have sage advice and is just so wise with some of the work that he does, but it's great to be able to pepper him with questions as well. So questions in the chat. The first, what are the other metrics in yellow, the area missing the mark? And I believe that goes back to one of the first slides.
Yeah, the first one is meet at least 11 of the 14 and 7 measure targets. So again, it is both of the QIM tracking metrics that are yellow, and Leslie can speak to this as well, but we are looking at making a proposal for next year's metrics for tracking, and perhaps having a duplicate in this space isn't helpful, and we could add another measure or something else that we could be looking at, because it's essentially a duplication of the same information. So
go ahead, Brad.
Oh, sorry, somebody else was speaking up.
No, I was just going to turn the floor to you.
Oh, thanks. So Tricia, I've noticed that that's been the same ever since I can remember. 11 of 14, that same metric has always been 11 of 14, at least for a year. So I'm just curious, like, if you're saying that yellow means we're confident we're going to get there, it's been a long time. So, and you mentioned you pulled out adolescent immunizations being the highest, whatever, priority or concern. So that's what I'm getting at. What are the other two?
Oh.
What are the other?
Am I understanding
So-
this right?
In order for us to achieve 100% payout, you don't have to hit 100% of the metrics. You only need to meet 11 of the 14 for full payout. So of the 11, of all 14, the one we are most concerned with is adolescent immunizations in that space. So that's why you're seeing that, because I think that's been consistent, although we are increasing and there will be more metrics for 2023. So I guess having said that, is your question, what other metrics are we concerned with?
Yes. So you mentioned childhood immunizations, adolescent immunizations. What are the other two?
Well, we are not meeting more than 2. So we are missing the mark in more than one space. Adolescent IMS is our greatest concern. But if it's okay, while our meeting is going on, I'll pull up and I can put into the chat the 4 or 5 others we are not currently meeting. I will say, even though we're not meeting, when we do the 12-month look back in the data, we are ahead of where we have been in previous years. So even though we're not meeting, we're trending better than we have in previous years. Our expectation will be that those metrics will turn to positive, with, I guess, the primary focus being on adolescent M. So I'm not sure if it's really valuable to see which ones we aren't making it, because we are trending better. And, Megan, maybe you could lean in here as a provider who receives that kind of information and see if there's anything else or anyone else that could lean in and.
About where we're behind, or?
Yeah, just this idea that even though we're not currently meeting it, we may be trending above previous trend lines. And we look at that data at I mentioned Megan because her and her team review that data monthly at a meeting. And then we are providing PacificSource the individual member names who have not come in, for example, for a child well visit check. So.
And it's kind of tricky because you have to meet the timeline. So if you get a kiddo in and you get them caught up, they don't fall into the numerator. So that makes some historical, like if kiddos were behind, it takes years to catch back up to the metric. And Marshall from our team can explain it much better than I can, but that particular measure is sort of not a quick one that you can fix because of the way it's designed.
Yeah, it's really dynamic space. That's why really looking at that 12-month fallback. I really don't think the population health team internally is additionally concerned with any other metric outside of that one right now. If that's helpful in that space. And then Carmen also put in the chat to me that to invite you to join the operations council where these metrics are discussed robustly. Down to each individual clinic's performance in that space. So those are open meetings, Carmen? Yeah.
So I appreciate the invitation, but I don't think I should need to attend yet another meeting.
No.
It just seems like if this dashboard means anything, if the yellow means anything that we should care about and be, pay attention to, then we should probably get more details on the yellow areas.
I can
I
work
would like
towards
more
that.
details.
Yeah, I can work towards that in performing that information. I think in a global way, if we can all talk about vaccines in positive light in our space, whether they are childhood, adolescent, HPV, wherever we get those opportunities as community members, as healthcare experts, that is certainly a place where we can lean in support and encourage community members to have conversations with their primary care provider if they have any concerns in those spaces. Could just be a really great global space to lean in here.
And I'll just add that when you look at like the current dashboard, it's through the end of September. And there is quite a bit of red versus green, but it's misleading because for the last quarter, you move from earlier in the year, you move from a rolling 12, which was going to give you a lot more green. And then the last quarter, typically you do year to date, but you have the full year. So for childhood immunizations, it's going to look, excuse me, for well child visits, it's going to look red, but you still have 3 more months to get, you know, the kids. You only have like 75% of the month's data to meet the full target. The target doesn't say, well, what's the target at 9 months? It says, what's the target at 12 months? So the current data looks pretty bad, but if you talk to our population health team that can look at prior years and trends, they are a little bit worried. That's why it's in the yellow. But the hope is that 11 and 14 are met, so 100% of the payout is received.
Dr. Davis, thank you so much for leaning in there. I was trying to, and for echoing what I was saying in a different way. Yes, I'm hesitant to put in metrics in the chat that will look worse than where we actually feel they are.
So is it, I'm sorry, is it not possible to report on like percent of goal? I mean, percent of goal at a certain point in time?
It is.
Because that would take away that concern, or at least minimize it.
Yeah, but it's just a point in time is I think where we're differing. So it's important to look at trend lines, knowing that we are currently trending above previous areas, although we are not at the target yet, which will put that in a red on our tracker. But in fact, population health is not concerned at all because we are trending above previous lines and they're working month to month. So they've really got the on the ground front lines information. It's a very, very robust document. It wouldn't likely go in the chat, but as this is a public forum, we could add global information potentially. I would defer to Carmen on this in a note, after follow-up for the meeting.
Yeah, sure. Let's take a look at that, Tricia, and how we can report it the way that folks would understand it. I know that some of the things we're working on are dashboards, you know, to make it look very simple to look at. But then there's definitely the detail that we need to go into for folks that are wanting to lean in more into that space.
We could do, I think we've done in years past, we've come, you know, toward the end of the year and said, hey, here's how things are tracking against the 14 measures or against the current metrics. Here's the ones that we're a little concerned about. Here's why. And here's what we're working on as a community to close the gap between now and the end of the year. So that would be easy to report out on at the aggregate level without the kind of clinic by clinic level stuff. So if that's what the board would want, we can, that's easy to do.
In the long run,
Just
Dan,
jump in.
that might be where, that sounds like a really great idea. I think in the long run, the challenge with this, at least having lived it for the last 5 years, is a lot of the delta sometimes lives in just one or two, like,
yeah.
You know, sometimes for us, I think we're down to like the last four kids. We've called them like 55 times. Like, I mean, their parents are sick of hearing it from us. So, so sometimes, you know, if one group has, you know, 450 opportunities and we only have 1 or 2, or vice versa, if we had 450 or whatever, it might be, you know, it might be helpful for this group to know where is the big delta, where does it live, and then is there any way one or more of our groups could help, excuse me, whoever has the big delta. And maybe that doesn't need to live here. I don't know. I'm just saying, like, we follow this. This is a weekly event at Summit, and you know, we're down to where we're down, you know, we're down to just the last few people on every metric. And, but the delta for the group, the delta for, you know, it is a lot bigger. So maybe there's a way we could help one of the other groups. Cause we've chased our 4 kids into the ground. Like they're not coming in for that shot this year. So, anyhow, so just wanted to throw that out there. Like maybe there's a way to illuminate where the biggest gaps are, and then maybe as a group think about how to help whoever has those biggest gaps. So
yeah, and I would share that exactly that work is happening in the QIMS work group space.
Great.
Right.
a subset of this group.
The Ops Council grinds into that in tremendous detail, and I think that's the appropriate place for it. And that's where, as I put in the chat, the clinics are able to really share their dirty laundry and say, okay, yeah, we're struggling here. What are you doing? And they don't, it's not a, they don't have to worry about a public presentation or anything showing up at the front page of the bulletin. So they're really able to get pretty honest about things there, and they do. It's a really collaborative format that's been going on for many, many years at this point in this community.
Thank you for that. It's a good discussion, and I think they're great questions that should be asked as the governing body for making sure that we achieve these outcomes and the health and wellness of our region. So I appreciate the questions that are being raised too. There was another question that had to do with interpreters, and it was, let me get to that really quick. There's a bit, what is causing the bottleneck for interpreters getting registered? Do we have some insights on that? Not necessarily, okay. Maybe a workforce?
I think the assumption being made is that it's workforce at OHA as well, that the workforce is across all systems being impacted. I'll reach closer out to our contact in that space and see if they've identified reasons. I mean, it's really just an internal addition of information into the registry. So it's definitely frustrating for all of us to do all the work to train and certify only to have another hold up in that space. So I know we'll be working with our partners at OHA to see if we can alleviate that and if there's any barriers there that we can assist with.
Wonderful. And it might be good, and maybe this has already happened, but had an opportunity to reach out to those that are current interpreters to see if maybe there were barriers that they might be able to identify that made it either sort of onerous for them to get through the process, or I'm not sure if that feedback has already been gathered, but it seems like a good spot to start. And then it appears that there is another question, which is great. And does the measurement method along the way need to be changed compared to previous year quarterly, historical, and or provide the percentage of goal that's quarterly?
I would ask, however, you as a board would like this information to be received, that we at Pacific Source are open to providing it in that format. So if that's something that you desire, I think our hope was in a stoplight, green go, yellow yield, red, really lean in and pay attention, was hoping to achieve that. But if we need to refine that method, we're happy to do that.
Excellent. Thank you. And I think, Carmen, if we maybe have a chat offline about how we want to present this to the board to make sure that we're doing the right level of monitoring and not getting too far into the weeds, but yet, can still see the fairway. So would be really great. So one of the questions that I had is in reference to, you were mentioning, although it was green, the behavioral health access piece. And it would be, I know that we have a couple of commissioners on as the Mental Health Authority. I'm just thinking it may be good as we're monitoring some of this in terms of, is that region wide? Is that into certain areas where we're seeing a specific access need? Is it within a certain population? Just diving into that a little bit more. I suspect that there folks that are on ops are going to know that, but if there's a way to gather that information for them as well in case that comes up, that'd be great.
Yeah, absolutely. And the measurement tool is anyone who has received a mental health diagnosis has received a service on that mental health diagnosis. So that is the measurement that we are seeking to gain in this space.
Awesome. And Kristen, thank you for peppering the chat with additional information. I see that happening as well. Okay, do we have any other questions or comments on this particular agenda item? All right, go ahead, sorry. Yeah, Brad, dive in. No.
The large number in gains, large number above the budget, I feel like that needs an explanation. Like, why is there so much mean, there's a lot of like cheering and happiness around it, but it makes me think, so is there more revenue? Is there less expenses? Or are we not, like, is the money not getting to the consumers? What's going on? I'd love some kind of an explanation of that.
Yeah, and we have our, Megan's like, please don't. We have our finance chair here with us, Megan, and as somebody who tracks this in a month to month, I'm curious if you want to lean in and if you've had a chance to see the most recent report, but I will say, I think the answer is yes in all of those spaces, not a decrease in consumer use, but that our revenue is up and our expenses are down. We've also had some adjustments that certainly Justin Samudio, our finance manager, really leans into in the 12 to 14 likely minimal lines that roll up into that consideration. And Megan, I see you've unmuted, so I want to give you the floor for a moment.
I was just going to say what you said, but there is that one thing that might be interesting for the group is there is a large amount of adjustments coming into the year. And that's sort of an interesting part of, I think, health plan budgeting. And I could take away, if the group would be interested, what kind of goes into those adjustments that come into future years, if that would be helpful.
So I'm sorry, but that I don't feel like I got an answer. I mean, it's a big number. It's twice the budget. I see that 13,000 rolled into this year from the previous year. That's also a big number compared to the $10 million budget.
Yeah,
So
it might be
ahead.
helpful for us to bring back some detail about the variances. So there's more revenue, the expenses are well managed right now. And there is a significant amount of adjustments of things that occurred last calendar year, that are coming into this year's financials for the CCO, which are pretty significant. So I think if we could take this away and bring it back to give more specificity to your question, I think that would be something we could do.
Also, I do want to clarify, because I thought I heard you say a $10 million budget. This is considerably larger. We are experiencing $30 million in gains, and we anticipated 10 million in gains at this point. So we're 20 million ahead, which 2/3 beyond what we expected to be at. The budget itself is significantly larger than that.
Yeah, thanks. That's what I meant.
Yeah, okay.
So Megan, that's a yes. I think it would be great. Maybe we could work offline with Carmen as well on that too, and bring some of that information back. All right. Any other questions or comments? Trisha, thank you. Thank you. Thank you. Thank you. Thank you. And thank you for always being open to the rapid fire questions and providing information, and to the team for supporting you as well. I want to welcome Iman, who's joined us, also Eric Kropp and Kat Mastrangelo. So wonderful to see folks. Next on the agenda, Carmen is up. We're going to talk organizational structure and program initiatives. So I'll turn it over to you.
Thank you, Tammy. So some of the conversation that we just had, I think will really lean into some of this structure of what Central Oregon Health Council looks like. And it's really a reset in terms of for me to understand and make sure that the board, I mean, this is what has been requested, is that we are really clear about our role and our governance for the work that's being done, and for the committees that are stated by our JMA contract and within the CCO model. So I'll just go to the next slide, please. And my colors mean nothing here. So just wanted to make sure that the blue is just for winter, it's cold. And so there's no significance in the colors, but it's really great that we can actually like put things out there so that everyone's really clear. So please put your questions in the chat. I'd love for you to put that in there to see if I have gotten it right, if the information and feedback I've been getting from others are correct, and how we can move forward as a board and with all of the different committees that are slated to operate the way they need to. So Central Oregon Health Council, just some very high level bullet points here, is a not-for-profit agency. It is community centered, which is what we've always wanted and designated to be, that community voice is uplifted. It continues to be transformational work with lots of innovation and pilots and things that we want to put out there that are different than what we've done before. We are the governing body of the CCO, and just as a reminder of that, is that this is Pacific Source, and how they structured this is to have a council. I actually went to the CCO conference at the state level, and there are many, many CCOs that do not have this model where they actually have a council that they are in partnership with the community. So I felt incredibly fortunate that we have this model. And other CCOs, when I was talking to them, they basically told me they have no other body that governs them. So I really believe that this partnership works really well. Again, it's to improve health, quality, access, and assisting in reducing the cost of care. And so these are sort of some elements of what the council is about. And I want to make sure that we're still all aligned in this space around here. Next slide, please. So this is our relationship, and I'm really doing this because I know that there's a lot of folks also on our board that don't sit in the healthcare space, and really I'm glad that there's a lot of folks here that are participating today. This is not necessarily meant to be a hierarchical model, but really it should be a relationship model that the Oregon Health Authority delegates to Central Oregon Health Council as an oversight body of the local CCO and the implementation of community health strategies. So Pacific Source is that community care organization for the region, and they represent our entire region, the Tri-County region, Deschutes, okay, I'm going to miss all of them, Jefferson and Crook, and including the Warm Springs area and north of Klamath. So that is designated as our CCO region. And of course, as Central Oregon Health Council, this is the body that carries out and is in partnership with the CCO. Okay, next slide, please. Now, these colors, again, don't represent anything. However, this is the hierarchical model that the CCO has designated across all CCOs. There is a board of directors, there is an executive director, and then there's a staff. In our case, we have a Central Oregon Health Council. And in each of all of the CCOs, there is a provider engagement panel, there is an operations council, and a community advisory council. So all of these pieces have to live there. Now, I have the governance and the finance committee next to the board of directors because as a board, we've decided that it's important for us to have a governance committee to make sure that the governance committee is holding the board accountable in meeting our strategic plan, our strategic vision, and everything that we need to do. The finance committee is also something that we feel is really important as stewards of this funding, that there is a finance committee that is reviewing these types of developments in our finances. The most recent uplift is the QPP payment methodology, which is amazing. It's a lot of Donna's work that she's brought forward, and that is actually will bring incentives and disincentives so that there's some risk sharing in that space. Okay, next slide, please. And this is just a definition of the provider engagement panel. Dr. Divya Sharma leads that as a co-chair. The Operations Council, and I'll speak a little bit more about that. And this is the Operations Council where there's a lot of organizations that sit in this space. Now, the Operations Council has really merged into more of a QIMS work group. So, Brad, this is that space where they're talking about these quality metrics, I mean, in a very granular level. And then, of course, the Community Advisory Council that you chair. And one of the things that I would love to see, and I know it was designed this way, is that there is more integration across the board for each one of these groups to be talking to one another. And we're actually we're actually seeing a lot of that. Something that was uplifted, for example, at the Operations Council, Dr. Davis sits on the provider engagement panel, so that we're able to have these conversations across all of these spheres, and that they are not actually isolated in these sort of bubbles. So I actually don't like to work in bubbles. So next slide, please. Now, to lean into the work groups, committees, and task forces. This is really where all the work is happening. And these are formed as part of our regional health improvement plan. But there's also emerging issues that come up and long-term project initiatives. So the current model right now is we have the RIP work group. These are the regional health improvement plan work groups. Each one of these are funded $2 million for the 5-year span. And those are the behavioral health, substance abuse, physical health. There's 3 more there, upstream, and housing, I think, is one of them. And these work groups are filled with people that are really engaged in those work groups. For example, housing, we have lots of people in the housing work group working on these issues on housing. And then the QIM work group, what we will be doing is we're going to move a QIM work group out of the Operations Council so that that group can continue to focus on the QIM's measures, those 14 measures that we discussed earlier. And that will allow us to really lean in further into those spaces. And anything that is, for example, yellow or red or starts to become yellow, those can be uplifted into the Operations Council. And I'll share that with you in the next slide. The second level of things that come up are groups, are task forces addressing immediate concerns. What has happened in the past, for example, is the Pain Standards Task Force was a response to community need of what was happening in the community. And so COHC held that body of work for over 7 years, but now it's actually migrated into the Overdose Coalition. Katie, I'm sorry if I'm getting the name wrong, but you can speak to that. And this is a place really where, COHC supported that work. However, a lot of the things that are sort of launching pads for COHC should be something that hopefully can institutionalize in the process. The same for emerging community or patient care issues. What I was finding was that folks were approaching me or letting me know about issues that are concerning in the community, whether it's housing, whether it's other things outside of the RIP work group. I mean, even talking about interpretation or dealing with these other issues that Brad was mentioning earlier. Where is that space to do all of that so that the work can actually happen and we get a report on it on the board level? And then last but not least, we have these regional broad initiatives. And these have been living in a bubble, again, another bubble. And how do we bring this into our Operations Council and say this DEI work is longitudinal? It is not something that lives in a bubble that a few people know about, but it's something that's embedded throughout our whole process. And the same thing for, these are examples I'm giving here, and the same thing for the Innovation and Health Information Exchange. That's another body of work that continues to work so hard in connecting our technology and moving it back and forth. Actually had a meeting earlier with Trisha on Unite Us and how do we get more people on that platform? But if that platform, is something specifically for Epic or these joint systems that you have providers that can afford this, what are the different tiers that we can be looking at? So those are some examples of those broad initiatives. Next slide, please. So one of the things that, really we would like to propose, and this is still in the works, is that the Operations Council really takes these broad initiatives, these emerging issues coming out of CAC or PEP or anywhere else in the region, and there's a central place where this can be managed. And of course, QIM and RIP work groups would actually give us a status update in this Operations Council space. Now, if things aren't moving, and Operations Council are decision makers, they are the ops folks in COPA, they are the ops folks in in the hospital and really talking about these spaces. And if these issues can't be resolved at the operations council level, then these are the ones that would uplift into the board, because the board is supposed to be governing these actions that we're working on. And I think that that has been a challenge that I have been hearing is, the board technically, the conversation in it needs to be from a governing body and not from an operational body. So this operational council will be able to hold this information and it won't get lost. That's the intent, and creating a system so that it's also talking to the provider engagement panel as well as the community advisory council. So I see this, for example, if there is an issue that's happening in the community advisory council, looks at that, works on that and says, this is something that's being uplifted in the community operations council, is this something that we can work on, and really as kind of a problem solving space. Next slide, please. And so in doing all of this, it's very, when I was looking at this, I was thinking about how can we not operate in bubbles or silos, and how can we move this work together? And these foundational elements are things I actually pulled out of our contracts. It's integration, innovation, our DEI work, access to services or programs, and advocacy. And so these are really the foundational elements of how we can continue to move as a region, as a board, and infused in every other spaces of what we're doing right now. So I think that might actually be the last slide. Let me see if that was. Okay, so next slide, please. Okay, so this is really sort of the proposal after talking about those 5, and I'll go back to that for questions. So the broad initiatives for funding in 2023, I'm seeing in 3 buckets. And the reason why I'm bringing this up to the board is because I would like to put this as a line item into our budget next year, to say that, let's take a look at some integration projects. Maybe they are piloting some specific workflow in a clinic, or broad regional initiatives like the IT initiatives that we have to, pay attention to. And of course, equity and access. On page 6 of my executive director report, you'll see a little bit more definitions of what these mean. For example, some regional initiatives speak about the housing plan that we need to position our region to access HUD dollars. Our IT closed loop referral system to provide stronger coordination of care between healthcare systems and patients, and so on. And so these are really efforts to start putting some resources into this work. And so that's my kind of broad vision right now. And the reason why I wanted to start with these is because there will be dollars associated with this. Last year, what we did was we had our impact incentive grants, which brought more than $3.2 million into the region, which is phenomenal. And we do want to measure the results of that and what will happen to that. And our impact incentive grants, what they were was, if you are a nonprofit organization and you applied for a grant, let's say from Collins Foundation for $200,000, the council matched up to $250,000. And so for those receiving those grants, they actually were able to double their capacity. So that was really a broad project that happened last year. And what I'd like to do is go back to basics and, move the CCO region with these integration projects, regional initiatives, and equity and access projects. That was a lot, wasn't it? That was a mouthful.
No, Carmen, first of all, I just want to say thank you for diving in the manner in which you have, and really coming with a perspective that is fresh, that is engaged, and really looking to break down those internal barriers that sometimes we create without really recognizing it, and the separation of some of the work that we're doing. And I hear you really wanting to tie that together. So I know that that's a goal of this board, and it's something that we've been working on. So really want to just celebrate that you have, that you're so quickly getting into that. So thank you. So board members, response to some of the thoughts that have been presented, some areas in which we want to be leaning in. Thoughts on what Carmen has presented to us? Anything that sort of sits funny or maybe is missing? Or maybe you love it and it's go forth and conquer.
Well, I'll take a first
Justin?
shot. Yeah, I thought it looks great, and I think it's a way to structure in areas where I feel like at least we've been kind of, whose is that, whose is this, and I do think one of the parts that will make that a very strong model is you have to have people who have the ability to vote for their organization, and then their organization actually has to back up that vote. So I do think making that model work will require having organizations committing to it in a way that, if people are going to go to those meetings and say, yes, this is what we're going to do, then their whole organization's going to do it, or they're not. So we probably shouldn't send the wrong people to those meetings. But thanks for taking a first stab at trying to solve I think an ongoing conversation of the last many years since I've been here of like, where does the rubber actually meet the road and what actually gets done? So nice job.
Thank you, Justin.
Thank you.
Linda, please.
Thank you. One of the challenges that I've faced since I've been on the council 5-6 years has been how information flows. I'm not on the ops council, what flows up to the board when. It has felt like there's a bifurcation of our attention, one being internally focused on the governance of the CCO, and the other being more externally focused on the Regional Health Improvement Plan. And that when we talk about refining a system, it's really about bringing those two together. And so I see possibilities in the model that you've given us that will allow us to more meaningfully do that. I know that's a question that comes up at CAC. How can CAC be more effective working with this board and with the organization to make sure that the concerns and the realities and the challenges that the CAC members are facing are actually integrated and heard by the people that are negotiating contracts and trying to improve performance on the QIMs. And so I think looking at a different model that isn't so bifurcated, that really is almost cross multi-tiered. It's clear, it's not clear. How do we infuse diversity and equity into all of that effort, not just in certain focus areas? I think it has a lot of promise.
Thank you, Linda. And actually that addresses the communication vehicle and, how do we get information without too much information? And it's that balance. And I think that there's opportunity as a broad regional initiative to create a communication plan and have, a dashboard that everyone can look at and really understand how to read that dashboard. So we could lean into the questions if something is standing out. I think that having the red, yellow, green, I love that. I love the colors that, it kind of tells us what to pay attention to. And then how do we have information that can go into detail around that? So thank you for that feedback.
Yes, Gary.
Yes, something that, has sort of been a concern of mine for a long time since the structure set up where we have metrics that are tied to revenue that, it seems like, and I think it's evident in some of the discussion today, we get so focused on chasing the metrics that we lose sight of how it translates into improved health and improved healthcare. And I see that as a missing link. And I think it was kind of evident in some of the questions and struggling for some of the answers. It's nice to dive into the weeds at the ops council level or some other level, as to the individual metrics and how we can improve them. And it's nice to translate that into green, yellow, and in some cases, unfortunately, red. But particularly as we are trying to articulate better with the community and the Community Advisory Council is, all right, how does that translate into improved health in the community? And I think, I feel like we've kind of lost sight of that as we're chasing metrics.
So giving that life, Gary, in terms of if we're struggling with access in one of the areas, what does that mean on the ground to the individuals that we're serving? We're not necessarily, maybe it means that we won't be able to draw in a certain number of dollars, but what is the impact to those that we are serving? Am I getting your,
Well, I think that, but sometimes I think it's also going back to basics. I mean, certainly everybody understands, what immunizations mean to overall health of a child population and to the community. I think sometimes, we are too siloed, and there's maybe not an appreciation where, why are we so interested in an oral health diabetic metric? And that's, I think it was Justin that brought up earlier that, we get so involved in chasing after that one individual that hasn't been in for their oral health diabetic evaluation. And a lot of it from our standpoint is that they don't understand the value of it, quite frankly.
got it. Yeah,
And you call them 6 times and they still don't get it. And we script our folks, and I think that could also apply to immunizations, although there are some hardliners on immunizations. There's hardliners on fluoride. They're absolutely not going to get fluoride. And I just think that, in some of what we do, we could do perhaps a better job of messaging the value of both the metrics and why they're there, but also the programs that we have to improve overall health.
so Brad, how does that sit with the tie-in with CAC, which really is representative of those that we're serving and being able to achieve that success of population health?
I'll try to answer that. I was going through all the stuff in the board packet again. Trying to listen and read. And I guess I would just say we need to connect. Really, the thing that has come to mind so far is connect the CAC's work to these 3 buckets that Carmen just presented. So, the CAC can have a discussion about that, but we're still, the CAC has a lot of work to do to increase the diversity in our membership, increase geographic representation. So I feel like that's where we need to focus so that we can bring more voices and get more input from the consumers, if that's helpful.
It sure is. Thank you, Brad. And thank you for leading that charge. Megan has a question in terms of being able to send out the slides, Carmen. Are the slides able to be shared? Wonderful. That's great. Other questions or comments? Reactions?
Yeah, this is
Iman,
just-
yes.
I would just like to say I support it, and it would be great to get those slides, Carmen, because I think that there's a fair amount of new folks at St. Charles in leadership that would welcome either me or you and me together, or some constellation to educate, I think, key operational leaders to what is the work and the tangible outcomes and the alignment with that between our entity and the overall Central Oregon Health Council. So I believe in structures, and I believe in the right people working within structures to get the outcomes that we want. So thank you for taking the time to think through that and to share it with us. And I look forward to getting those slides.
Thank you. So I will be recruiting for the Operations Council. So you might be getting a message from me, or if you would like to participate, would love to have you be part of that decision-making body to move the operations piece along.
For sure. And I'm going to use those slides to build up my team. So it'll be a win-win.
Oh, that's so great. Thank you. And it just, again, those values about advocacy, access, DEI work, integration and innovation, those are not new words. That is something, to kind of, what did Tammy, I think you said a true north. It could be something that can help guide this group so that it reminds us why we do the work that we do for the most underserved. I hear stories all the time about how people are being helped with the grants that we're doing, and I don't think we're showcasing that enough. So stay tuned for more outcome reporting next year.
I think we have Dan and then maybe Linda as well. And then Mike.
Perfect.
Yep, go right ahead.
Carmen, echoing the comments about thanks for putting it out there and kind of building a frame. My question is would this be synonymous with an updated strategic plan for the Health Council? And if we went around the room, hopefully most people would have a similar answer. If we said, hey, what strategic plan are we operating under right now? My answer would go something like, well, we've had these 3 pillars, right? We start with mission, vision, values, guiding principles. And then we've moved to we have these 3 pillars. One is governance of the CCO, which I saw in there. Another one has been around ensuring that we have a robust, regional health assessment, regional health improvement plan, and then tactically moving that forward through work groups, through funding, et cetera, measuring. And then the third is this thing that's been a little more amorphous, right? But long-term systemic change. And that's kind of spoken to some of the other ways that we take money out of the shared savings and invest it upstream. And so it's always been, maybe it's kind of to Iman's point, like I like the clarity of kind of what's the operating frame, what's the mission vision frame, and then what are the priority pillars, if you will, which is a term we use. And then below that, we kind of have the initiatives and the work groups that support that. Is that kind of where we're headed with this? Is this intended to be our updated strategic plan for the coming cycle? Or is it more just additive or augmenting our existing plan?
I don't know if it's necessarily augmenting. We haven't gone to that level of the strategic plan yet. I know that staff has continued to work really hard in meeting a lot of our strategic plan goals. But I do believe our team is going to take a look at the strategic plan and say, this is what it was, this is where we are, and where are we headed? And so there's a gap there in the middle that we need to work on as staff, and then we'll present it up to the board as far as, where we're headed.
Yeah, it does. Do we have clarity at the board level of our strategic planning cycle, deliverables, how that informs budget at this point in time or not? And if not, I would maybe be so bold as to suggest that we do clarify that. And again, Carmen, I think those slides are a great start. It feels like it's the stuff that could become our next strategic plan, but I'm seeking that clarity of what we're looking for as a board.
So I would say that this is the framework for helping Carmen be able to pull us together for some of that. I don't know that this, in my mind, there's a blank page there, which is how does this factor into where we were hoping to be with our strategic plan today? And then where do we still want to be moving some of those initiatives forward? And how does this alignment maybe with the inner workings of the network of committees and structures that we have help us to achieve that? And so maybe outlining that a little more clearly in the future, Carmen, in terms of that, I mean, for you with where you want to make sure you're doing a check-in. Hey, does this sound okay? This is sort of what I'm seeing. But in terms of tying us as a strategic direction, I think we might want to put a little bit more meat on those bones, but that was my understanding was the intention.
Yes, that's absolutely correct. And a strategic plan is also a plan, just like a budget. And so, knowing that it has areas where it can shift or update, improve, take in a lot of what we've done already, because I don't know, I couldn't give it a percentage right now to say how much we've done, but I believe it's a 5-year cycle I don't know, staff, Gwen, would you know? It's a 5-year cycle, right?
Yeah, I have it up. We started it in, if you remember, March, that wonderful month of 2020,
Yes.
slated it for 2025. And we did the consensus workshop that is probably a big flat blur right now. And ended up with some strategic directions that are like the next layer down of detail beneath those three pillars. And we can definitely send out some of those higher level pages to just refresh that conversation and reset as needed be. So yeah.
Our team went through a staff retreat in October, and that was our opportunity to get together and really understand these values or our true north or resetting. And then throughout the winter, we will be going through our strategic plan. And so I'm hoping that we'll have something ready sometime in February.
So we will want to engage the board in what that strategic direction looks like. So let's talk offline about how what you've presented today can help to factor into what we currently have. And I think we can all, share how things in our own worlds have changed a little bit since 2020. And so we might want to reset and reflect, and this will be a wonderful opportunity to do that. And I hear us wanting to strengthen the committee structure and maybe shore that up a tad so it can be a bit more streamlined and sort of surgical in terms of the ways in which we're trying to deploy people. Right now, we have a whole lot of people attending a whole lot of things that have a fair amount of crossover and slight duplication. So Linda and then Mike. Yes.
I think one of the things that I've learned is that sometimes just shifting who's in the conversation really starts to open up new possibilities. And I have concerns in any model if we're focusing on, I'll use Justin and immunizations because it's one area I do have a little bit of knowledge about. Working to get the providers who have those few outlier kids who haven't gotten in it. You can work it at a granular level, and at some point that's really important. But also if we only have providers, for example, in that conversation from a contractual perspective, I worry that we miss system opportunities. What is it that the system is doing to impact all providers? But we're so focused on the granular that we miss the bigger questions about equity or what are the incentives that the system creates that work against the providers. And I'm thinking that what model that Carmen has proposed shakes things up a little bit. We still focus on the right conversations, I think, but we have different players perhaps and different ways to think about it so that those system perspectives can become more apparent. And then as an entity here, as a CCO, hopefully it would be clear to us what are the system things outside of provider performance that we also need to do, because that's a part of our role and mission as well.
I 100% agree with that, which is why we can refocus on regional initiatives and broad initiatives to continue that upstream work that we need to be doing.
I'm on mute. Mike, sorry.
Yeah, having sat on the Gang of Six to develop the legislation on the oral health perspective, and then sitting on the Health Council back in the day when they developed the organizational structures and the bylaws, and then see the committee structure develop, and then see all the new folks that are here. It was refreshing to see Carmen put it together and relook at it, because behind all of this is legislation that created a lot of what we're doing here. And I thought it's really fascinating, because it's amazing how you got to continue to revisit what's going on, because as people leave and change, the whole mission of the whole thing gets lost in the shuffle, and we forget sometimes just exactly why we're doing what we're doing, because we weren't around when we decided that. So Carmen, it was good. It was nice to see you being new here to go through that process and revisit that and update yourself about it and refresh us.
Thank you, Mike. That's a great perspective. You're right. So a suggestion has been offered of pulling together a small group to help guide some of this work in tying together where we had left off with our strategic planning, being able to look at some of the pieces that Carmen has brought forward in terms of objective of streamlining and sort of leveraging some of those committees and the work being done. Is that something that we feel like would be beneficial to assist us in pulling together a document to bring back to the board to react to? And it probably would be good if we had another strategic planning session or a way that we pull ourselves together and maybe sort of reconcile that collectively. There's an exciting energy that happens when we have an opportunity to do some of that work together in person. Okay, I'm seeing a yes. I'm seeing some heads nod as well. Nodding heads is great. Okay, excellent. So all nodding heads, that is a yes to be on the committee as well. Just kidding. But if you have a particular interest, and it doesn't need to be a standing committee, but if you have a particular interest in this effort, please let us know. And that could be just an email either to myself or to Carmen. And Carmen, I really just want to say great job. This is an important conversation. And also critical to your success of, am I getting it right? So thank you for the check-in.
Well, I just want to say thank you for everyone's support. Everyone's been amazing. Honestly, our board is amazing. I actually met Seth the other day. So that was really cool to visit him in Crook County. And Iman, I met, Todd gave me a tour of the hospital. So, just all of the different spaces that everyone's been really supportive of. I feel very blessed to be in this space. Thank you.
Well, and we are fortunate as well.
Tammy, one more comment.
Yes, please.
Oregon's CCO is actually a version of an accountable care organization. And one thing we might want to do, and I'd be happy to sit on the committee to do that, is to go back and look what an accountable care organization is and how Oregon developed their accountable care organization, because that's really what it is. A group of providers with a group of people for a fixed budget for certain outcomes engaged with the community. And so when you begin to look at the community members, where you have the county commissioners, you have the CAC, which is actually legislated, you have the PEP, which is kind of legislated, is suggested in the legislation, you have the health council, you have the structure that's put together like Pacific Source did, which if some of you remember that have been around, Pacific Source, they wouldn't let us do it. You remember, Dan remembers, and so does Megan and some. They wouldn't let us do it in the beginning because they said it wasn't the way it was supposed to be. And it took a lot of effort. It took a lot of effort to do that. And as it turns out, having been on many of these committees over time, that it's probably the structure that works the best. But it wasn't easy to get here. And so it sometimes it's good to go back and visit what we're trying to accomplish. And I really appreciate Carmen doing that. Thanks for the opportunity to share that.
No, thank you. I mean, honestly, I've had a lot of guidance as well from our Pacific Source partners. Tricia has been amazing in helping me this first 6 months, just understand all of our acronyms. So, I think that we are leading differently than other spaces in the region and in other states. I am looking at that also. And also the legislative session is coming up in the spring. And I will be bringing forth some legislation that just informational, just so that people know what's happening.
Excellent. Not to be misunderstood that we're creating our own legislation and trying to fly some, changing the framework, but that will be beneficial so that we all are operating off the same sheet of music and have an idea of what areas could be influenced, changed. And one of the things that we benefited from over the years is being able to, if we feel it's the right thing to do, defend the model that we have and defend the things that we feel like we are able to do in our region, which may or may not be the same and benefit the same areas across the state. So of particular interest, and certainly being able to draw more dollars into the region to be able to serve more people. So wonderful, great job. Next on the agenda is the a quick update on the regional housing plan next steps. So at our last meeting, we had a discussion about the who's on first and who's doing what in the space of addressing our unhoused crisis and some of the housing issues that we're struggling with across the region. And so getting to Carmen's notation of strategic initiatives, one of the areas in which we've identified for the Health Council is housing being a public health crisis of individuals who are unhoused. And so there is a continuum that is required to do regional planning, and that is the Homeless Leadership Coalition. And so they're currently under discussions of what a planning effort to draw in our region, identifying areas for all parts of the county or of the Tri-County area rather, in discussing what needs to happen in those areas in terms of services available, shelter services. It really is the grassroots planning document that is required by HUD to receive the funding into the region. It would complement nicely in the work that's being done in Deschutes County and the cities within Deschutes County as well. And so more conversations with Carmen about what that looks like in terms of the funding of such a plan. And it appears that a planning effort such as that would take place likely in March. The reason for that is that the region would be working on the requirement for addressing the point in time count and meeting that need, and being able to also stand up some other initiatives that HUD is currently requiring. So the Homeless Leadership Coalition is the organization that would be taking the main lead on that. The Central Oregon Intergovernmental Council, our organization, will be supporting them and helping on that. But your organizations will clearly be impacted in being able to provide input and guidance and insights into it as well. And there will be a committee that will help guide that work, of which many individuals probably around this table will be involved in as well. But just want to make sure that on the horizon that we don't leave the housing conversation without next steps, which is that regional planning effort will be required and likely stood up in the March timeframe. Any questions there? All right, so the last item on the agenda is announcements, and I had promised a light meeting, so looks like we're going to be able to stay true to that. But any announcements that we want to bring forward? I know that we have the Latino Community Association luncheon. Oh, Carmen, go, please. Yes.
Well, mine is a question, and for Justin on the latest and greatest news, if anybody has heard.
Yeah, thanks. I don't think I can get into exactly what it means yet for like the overall big company, but I could probably just do like a bit of history. Obviously, we're super proud, 4 or 5 years ago when I first came to the Health Council, BMC had been probably effectively bankrupted for 3 or 4 years, and we had pretty poor quality scores and customer satisfaction scores. We had 80 providers, 325 staff. So we're really, we're super thrilled today to be, part of this news that, we have the highest quality scores in America, perfect Medicare MIP score. We're a 10 Gold Star Epic member. We've doubled our provider count. We have a 96% customer satisfaction rating, and we've really transformed into a value-based care leader in the country. So we're really excited about what you're reading in the news. I think we can come back. I can come back next month and give you a lot more detail. I think our local journey in Oregon, though, it's there are very few companies in the history of the country that have a story like this. So we're super proud of what we've been able to achieve in becoming a value-based care leader in the country. And we're really excited about what it means in the future. So happy to come back next month and tell you guys a lot more about what it means in the overarching for the country, really, and what we'll get to be part of. But at least for Oregon, you should know nothing really changes for us. And it's been an amazing journey for 5 years. So thanks for asking, and I'll have more for you next month.
Thanks, Justin. Could you just sort of reframe what the news is for those that don't know?
Yeah, when we originally joined Summit Medical Group in 2018, we rapidly, made a very big transition of the practice here in Oregon, and as such, we were included in a partnership between CityMD and Summit Health, which came about right before the pandemic, right about at the end of 2019, the early 2020. That group grew from, I want to say 1,100 providers to over 3,000, 5 states, and what you would consider 12 distinct markets. This week there are announcements about our partnership with VillageMD, which has 1.6 million attributed lives. It's a value-based care company, and that group operates in 22 different markets and has some of the best quality scores in America. So I can't really say much more than that, because I don't really know much more than that. It's been a whirlwind, and of course, take everything you read with a grain of salt. Some stuff's true, some stuff isn't. So but as I know more, I'll be happy to come back and tell you. I guess my official statement is that's what the articles say, and but don't believe everything you read, and I don't know much more than that I can publicly talk about today. So happy to come back next month and try to fill in a little bit more of those details when I know more.
Well, suffice it as a congratulations from the group. I'm seeing a lot of congrats in the chat as well. So we'll look forward to what you can share in December. And I'm sure it means a little extra time on your hands too. So enjoy.
Thank you guys all. Thanks so much.
Of course. Yay. So then we also have the Empowering Families Luncheon coming up, and Brad has put that in the chat. They're still looking for some business sponsors. And so that's December 1st. Hope to see some folks there. It's always a really wonderful, just exciting opportunity to support community. And it's a great lunch and just always feels wonderful to be there among friends. So, and thank you to Pacific Source for support of the luncheon and the mission of FCA as well. Any other announcements? Okay, it looks like Tricia put one in the chat as well. Their community conversations luncheon between the Health Council and Pacific Source. And oh, you're welcome, Brad, Health Council. I'm doing my best to read the chat as we go through. You could probably do that on your own as well. But any other announcements that we want to share?
We just would encourage people to RSVP for the Health Council and the Pacific Source Luncheon. And I think they sent invites out. If you haven't received those invites with the link to register for the event, Carmen, I'm going to ask that they reach out to you in that space. And we'd love to see you in person for a chance to gather and hopefully continue to have conversations about how we can serve the community best, coming back to something Gary brought up earlier.
Wonderful. And thank you for the opportunity. I mean, that just in and of itself, an opportunity to talk with our contractor and be able to refine what's working and chat about the things that maybe we want to do a little better. It's, I mean, that type of feedback is usually not what happens. So thank you for being that organization to partner with. Okay. Well, if we don't have other announcements, I hope to see everyone out and about with some of these events coming up. Congratulations, Tony. Congratulations, Justin, and to everyone else. Take care, stay warm, and look forward to seeing you all soon.
Have a great day.
Hey, bye.
Thanks, everyone.